Hello everyone, I'm Dr. Mehokhu. I'm working as an SMO in the ART Plus Center in Kohima, Naga Hospital. Today my topic will be adolescent health. How we define adolescent? Adolescent is the period of year in which there is an acceleration characterized by the acceleration of physical growth, behavior, and psychological changes. It is basically the transformation from a child to an adult. So during this phase of life, the person is neither a child nor an adult. The developmental changes which we see in an adolescent triggered by a chemical known as hormones. There are three developmental changes. One is physical, one is emotional, and social. So during the physical change, what happens is in a girl, there's enlargement of the breast and broadening of the hip. Then there are growth of hair in the armpit, in the pubic area, and also the onset of menstruation. In boys, the developmental physical change, which we will see are growth in height, changes in the voice, like deepening of the voice, and also development of facial hair and growth of hair in the armpits and as well as in the pubic area. The second changes which we see in an adolescent during the developmental process are emotion. Emotions such as feeling of shyness, loss of confidence, then attention-seeking behavior. Then we also see things such as search for their own identity, to establish their own identity, independent thinking, sexual attractions, and so on. These emotional changes, during these emotional changes, certain things such as risk-taking behaviors like abuse of alcohol and drugs, as well as unsafe sexual practices sets in. Then thirdly, we come to the social changes. Social changes are mainly developed due to the influence by the environment, by the family background, and also a lot of major factors contribute to the peers. And like there's an immense peer pressure during this phase of life, which can also lead the individual to develop certain behavior characteristics, and also the search or development of new relationships. Puberty. When the onset of puberty will vary. The normal time for the onset of puberty in girls is 10 to 16 years of age, and in boys is 12 to 16 years of age. In girls, it is a few years earlier than the boys. And due to this variation in the onset, certain individuals, they may develop anxiety due to, like, say, they're growing up in the same environment, same background, same school, and if a certain boy develops it earlier than the other boy, it may feel abnormal. So such feelings or anxiety should be reassured that it is a normal process. Another factor, like regarding the onset of puberty, in certain boys and girls, it can be also delayed. Like, it can be delayed, or it may be earlier than early. It may have an early onset. So if a girl, like if the puberty starts before 9 years of age, it is of concern and should be referred to a doctor. As well as, like, if the girl, say, like the menstruation, it starts after 16 years of age, can also be a health concern and should be accordingly referred to a doctor. the importance of acknowledging this adolescence is during these adolescent years, it is the formative years in our physical development, in our behavior and psychological development. And also it forms the foundation for our future adult health. Certain things such as increasing the awareness among adolescents, then nurturing healthy habits, and also building up the self-esteem and confidence is very important during these years in order to help the individual to grow into a mature, healthy, confident adult. Next, we will be talking about the certain issues, health issues, which adolescents face during this period of time. These issues, health issues, are specifically more common among the adolescents. The health issues which an adolescent face are as such like menstruation. There are certain issues concerning boys, then there are some behavioral issues and also some nutritional issues. Health issues concerning adolescents are quite specific regarding adolescents' health and during this period of time. Number one is menstruation. Menarche. Menarche is the period in which a girl starts her first period, which is normally within 9 years to 16 years of age. Once a girl starts having her periods, the menstrual cycle is counted from the first day of the cycle to the first day of the next cycle. And usually that cycle is around 22 to 45 days. The period lasts for around 3 to 7 days in a normal individual. The problems, the health issues which adolescents face during the regarding menstruation is irregular menstrual period, then heavy bleeding and also painful menstruation. Irregular menstrual period can be quite normal regarding adolescents during the first to second years of age. Then comes heavy bleeding, in which the period lasts for more than 7 days, or there is heavy bleeding. So it is usually due to the fact that sometimes some imbalance in the hormones, it happens in the first or second years during the onset of menstruation. But if the heavy bleeding continues, we should not be hesitant to refer that person to a doctor. Then comes painful menstruation. There is some girls may experience headache, may experience diarrhea, abdominal cramps. This is also usually quite normal in some girls, and there are many home remedies which can help during this painful menstruation. Like certain home remedies which I would like to suggest is like taking a hot water bag and then covering it with a towel and gently placing it in your abdomen, or drinking some hot ginger tea. Okay, another thing known as PMS, okay, premenstrual syndrome. This refers to a combination of physical and emotional symptoms experienced by women and girls during the menstrual cycle just before the bleeding begins. These symptoms include headache, pain, abdominal cramps, irritability, weight gain, heaviness, especially in the breast. So it is important to make sure that the girl understands that these symptoms begin 5 to 7 days before the period starts and disappears before the bleeding begins. This can be managed with remedies for pain, like low intake of salt, eating a lot of clean and fresh vegetables and fruits, and which is high in fiber. And also for the pain, we can go with a hot water bottle fermentation. After PMS, what we should try to make the girl understand during the menstruation is certain counselings regarding, like we have to remove certain myths regarding menstruation. Number one is it is not a it is a normal physiological phenomenon which everybody goes through. So they should not be ashamed of it, or there should be no embarrassment regarding menstruation. And also there is nothing impure about it. So there should be no isolation or seclusion of the girl during her menstrual period. It is, and also another thing is that it should not be an obstacle to her daily activities, such as if a girl is having menstruation, she can still continue her or daily normal routines, such as going to school and other activities. Another factor regarding menstruation is menstrual hygiene. One is like changing of the sanitary pads regularly. A girl, if there is heavy bleeding, the pad should be changed every day, because heavy bleeding can lead to irritation of the thighs. Like if you keep wearing the pad for a long time, it may cause irritation of the thighs. It can help in infection, bacterial infection, and also heavy bleeding induces bacterial infection. Then, so what we should teach the girls is regular change of sanitary pads, and number two, washing and taking bath regularly during the menstrual period. And if there's soiling of the underwear, it should also be washed if there's soiling with blood, because blood is a good medium for bacteria and that can lead to certain infections. So taking bath, washing the reproductive organs is a must during the menstrual period. And also while changing the pads and while changing the pads, the girls should also have a knowledge about washing her hands properly. Then also in disposing of the sanitary pads. In certain situations, when a girl does not have access to a sanitary napkin, they can use a clean cloth. And this clean cloth should be changed 3 to 4 times during her periods. And once the periods are over, these cloths should be washed in hot water and soap and dried in the sun. Next, we come to some adolescent health concern regarding boys. In boys, during this surge and this acceleration of the growth and this surge in hormonal activities, there is a phenomenon called, in which everybody is aware, called the erection. So, like during this period of time, a young boy may, with or without sexual thought, external stimuli, or fantasy, or anything, may have an erection at any awkward time of the day or night. So what we have to make them understand is that it is a normal phenomenon during the adolescent period and the pubertal changes. Another thing regarding boys are that about night emission, or what you call as wet dreams, which is also a normal phenomenon during this pubertal time and may occur more often. So, and lastly, we should not forget about talking to a young boy about his genital hygiene. We then come to behavioral issues regarding which affects a young boy. This is another interesting and important topic regarding concerning a young person who is going through adolescence. We see many different behavioral issues may vary from many different people. It may not be similar, it may be influenced by the environment, by the background, by the social society, and by the family, and also by the peers. As part of growing up, we see many behavioral change or observe in a young individual, young adolescent. In some individuals, we see aggression or conflict with either the parents or others. In some individuals, we see complete lack of confidence or shyness. In some individuals, we see attention-seeking behavior and mood changes. These behavior changes or emotional changes may vary a lot in many different adolescents, and this should not be ignored. This should not be ignored because these emotional changes are usually the one that leads them to high-risk behavior, such as drug, alcohol use, unsafe sexual practices, and also delinquencies. So this behavioral change or emotional change which we see in an adolescent should not be ignored, but they should be corrected and acknowledged and recognized so that we can give them the proper awareness and also help them make their decisions as they grow up into mature, healthy adults. One thing regarding when we talk with adolescents is we should try to have an open and trusting relationship with them, which can be achieved by empathizing with them and listening to their problems and issues and not being judgmental. And also, when we develop that kind of relationship with them, it becomes easier to communicate, to communicate and to understand their issues. So once that is developed, we can help them. We can help them make their proper decisions. We can help them nurture their habits so that those habits do not lead to harm or self-harm in the future. Another issue regarding adolescence is nutritional anemia. In a young boy or a young girl, due to the rapid growth and the rapid increase in the body mass, there is increased demand for certain vitamins and minerals like iron, vitamin folic acid, and vitamin B12. These are more important because if they are not looked at an appropriate and in the right time, may lead to negative outcome in their health. It can also lead to nutritional anemia, which can have a worse or more negative outcome, especially among adolescent girls and the girls in their reproductive age. Anemia, if not corrected in time, can lead to high maternal mortality, preterm babies, and pregnancy complications in young girls. So if this anemia, if recognized, should be corrected at the right time during the developmental phase. There are certain government programs in which they are focusing on children, especially children from adolescents from 10 to 19 years of age, and girls especially from 6th standard to 12th standard. This is a program run by the government in which there is a weekly distribution of IFA pills, which is iron and folic acid pills. These are given to them as in a directly observed therapy. So these pills are given to, especially in the adolescents in the government, studying in the government setup, they are given to them in a weekly basis to help them correct the anemia. Lastly, I would like to say that the concept of sexuality are laid down during this phase of adolescent life, and it's important. It is very important that the adolescents have access to the correct and complete information related to this. This information is provided by trained counselors at the adolescent-friendly health services centers based in the district hospitals and the community health centers. Failure to provide adolescents with appropriate and timely information represents a missed opportunity for reducing the incidence of unwanted pregnancy, sexually transmitted disease such as HIV/AIDS, and their negative consequences. Thank you.